This video is going to begin an overview of the bones of the human skeleton. Now, because of the number of bones, and especially if we were going to get involved with, the processes, the openings of the foramina, the ridges, etc., we begin by dividing the skeleton into parts. So the part which runs up and down the long axis of the body is known as the axial skeleton. This consists of the skull, which is obviously along the midline of the body, the vertebral column, which obviously runs along the midline of the body, and then the thorax, composed of the ribs and the sternum. So these three regions are what are called the axial skeleton, running up and down the long axis of the body: the skull, the vertebral column, and the thorax. The remaining part of the skeleton is referred to the appendicular skeleton. This is the bones of the arm, the leg, and the girdles which attach the arm and leg to the axial skeleton. That would be the pectoral girdle in the shoulder region, and the pelvic girdle, the hip. Beginning with the axial skeleton, the skull is composed of two main portions, the first being the cranium. Now, when we look at the skull, clearly one of its main functions is to surround the brain with a bony box. So once again, here is the skull, the thorax, and the vertebral column running up and down the long axis of the body. So when we look at the skull here, you can see that the brain, which is made of very delicate neural tissue, needs to be protected. And so, therefore, many of the skull bones are doing just that. They are essentially enclosing the brain in a bony box. These bones are called the bones of the cranium. The skull then also includes bones which are not enclosing the brain. They do not surround the brain, and they would be in this region here. And these would be bones of the face, including the jaws, bones surrounding the nasal cavity and orbit, although not all of them. Some of them would actually be cranial bones. And so what I'd like to do is begin with the bones of the cranium, and then proceed to bones of the face. Let me do the video first, and then look at the individual images and point out significant structures. And so if we were to make the face go away, then we would be left with the skull bones, which compose the cranium. Now, if you were to look at, say, an image, say in a textbook, one of the things that the image would then have to say is, what type of view of the skull is this? Is this a frontal view here? Is this a lateral view or a posterior view? Frontal view could also be an anterior view. Or a view from beneath. Is this an inferior view? So notice that the bones of the cranium that you are going to see in each of these views will vary. So here in this anterior, this frontal view, we see one very large bone, the frontal bone, which when we were children was made of two separate bones which fused. As we see a frontal bone, you can see a bit of the parietal bones and the temporal bones, which we will see better from the lateral side. And then you can also see an ethmoid bone and a sphenoid bone here. These are typically difficult to see. We can see them from multiple views, but they are best seen when the face is removed. So in the skull, the cranium attaches to the face, and some of the bones which are involved in this are thus difficult to see as long as the face is in place. So here are the bones which we would see from this view of the skull. Once again, if we were to make the face go away from this lateral view, we would then see that single frontal bone we would see the bones of the lateral view, the parietal bones, the temporal bone. You can see the occipital bone, although that would be best seen from a posterior view. And notice you can also then see the ethmoid and sphenoid bones from this view as well. So these are the bones of the cranium. And so beginning with this frontal bone, once again, it is a single bone here. It makes the superior portion of the orbit, as you can see. Once again, there you can see it making the superior portion of the orbit. A quick note on the frontal bone and the orbit. Ancestrally, the frontal bone was a flat bone. And there were other little bones of the skull, which mammals no longer possess, like prefrontal and post-orbital bones. The earliest mammals lost these bones. And so thus, in the first mammals, and in many mammals today, like this armadillo, the eye fits here and the jaw muscles fit here. There's one space for both of them. If you were to look at this mastodon, the eye would fit here and the jaw muscles fit here. There is no space separating them. So the ancestors of mammals had a bony bar separating the eye from the jaw muscles, but the first mammals lost that. Now, mammals have since decided, you know what, maybe it would be a good idea to get that back. And so a few mammals have, like horses and camels. Notice this cat almost has a post-orbital bar. Here's the eye socket. And notice that the frontal bone is almost contacting the zygomatic bone of the face, but not quite. So here's the eye area, here's the jaw muscles. There is an almost separation there. But primates, because they use their eyes and depend on their eyes, this became very important and is one of the defining features of primates. The first primates then develop an extension of their frontal bone to contact a bone of the face, the zygomatic bone, to create this post-orbital bar. So the frontal bone not only makes up the superior portion of the orbit, but then it also contacts the zygomatic bone, and so that in humans and other primates, the eye is completely encircled in bone. Now, you may notice that some of the bones have holes in them. They are called sinuses. These sinuses lighten the skull. They provide resonance chambers for speech. The mucous membranes here are creating mucus which drain into the nasal cavity. And so here we have a sinus. If the frontal bone is sectioned at the right level, you can see that of the 4 bones of the skull, 3 in the cranium, which possess sinuses, the frontal bone is one of those bones which possess a sinus. So here you can see 2 different skulls, and once again, if the frontal bone is sectioned at just the right level, you can see the sinus. And then lastly, from this view as well, notice you can see the frontal sinus there. There are other bones, the ethmoid, the sphenoid, and the maxillary bone of the face, which also then have sinuses. And so that is the frontal bone. Now, there are a pair of parietal bones which make up much of the lateral portion of the skull. So here you can see a parietal bone. Here's a parietal bone as separate. Here you can see how much of the expansion of the brain, that the expansion of the parietal bones was able to. If we were to think about what makes us human, obviously the great expansion of our brain is important. And so when you look at ancient skulls, Australopithecines have a brain volume which is within chimp range. Homo habilis a bit bigger. And Homo habilis, if you notice, there is more of an expansion of the cranium. The frontal bone is higher. And then if you notice how wide the parietal region is clearly the expansion of the frontal and parietal bones have had a role in making the brain larger. Now, all of the early humans had a differently shaped skull than Homo sapiens, which is a very recent species. There were lots of species of Homo. And the skull in earlier humans was lower and longer. Now, it gradually increased in size. So when we look at, say Homo erectus from 2 million years ago, the earliest Homo erectus had brain volumes which were low, like this one. But by the end, Homo erectus was within modern range. And so Homo georgicus, which is the early Homo erectus, notice the volume a little bit less. Notice there's no forehead. The skull tends to be low and long. And we see this in typically in these skulls. This would then become pronounced later. And so once again, there was lots of species of Homo. What makes our species distinctive? Well, once again, if you were to look at these skulls, most species of Homo had skulls which were lower and longer. So Homo erectus, Homo neanderthalis, Homo rhodesiensis, which we could call Homo heidelbergensis. There was a more prominent brow ridge, and there wasn't as much of a forehead. The skull was low and long, whereas in our species, Homo sapiens, notice the brow ridge is less prominent, and notice the forehead. Your skull goes straight up. And so the frontal and parietal bones, their expansion helped to allow for the expansion of the human brain, but also makes us distinctive as a species from all of those earlier species of humans. Now, as we will discuss when we talk about joints and articulations, you don't have to be able to move to be considered a joint in the skeletal system. And so here we see joints between the two parietal bones. We see joints between the parietal and the temporal bone, etc. We call these sutures. Now, when we look at these bones, for strength, these skull bones then interdigitate so that they kind of lock together. This is considered a joint, although it doesn't move. There's a name for that, a synarthrosis. And if you wanted to, you could name these sutures. So you could call this the sagittal suture, being along the mid-sagittal plane that separates the two parietal bones, or the lambdoid suture, which separates the parietal bones from the occipital bone, or the coronal suture, which separates the parietal bones from the frontal bone, or the squamous suture, which separates the parietal bone from the squamous portion of the temporal bone. In the posterior of the skull, there is one occipital bone, and its perhaps most prominent feature is this large opening, this Foramen Magnum. Its name literally means big hole, foramen meaning hole, magnum meaning big. So the occipital bone has this Foramen Magnum, and it's here that the spinal cord then enters the skull and becomes the brain. On either side of the Foramen Magnum are these processes known as occipital condyles. And when I shake my head yes, what's happening is the occipital condyles are moving against the first vertebra, the atlas. Notice there's nothing here supporting my head. I'm not holding my chin up to my ribcage with a bone. So it is here that the skull is supported. The first vertebra then rests here, and the occipital condyles then articulate with that first vertebra there. Now, when the occipital bone forms as a fetus, it actually forms as a whole lot of little bones, which then all come together. And it is not uncommon that from all of these separate elements which fuse, that there can be then one person who still has little separate bones where the suture is, say in this lambdoid suture between the parietal bones here and the occipital bone. These could be called wormian bones or sutural bones or Incan bones. And they are common enough. And so you might have a different number of bones in your skull than, say, the person next to you, because you might have these wormian, Incan, or sutural bones that the person next to you doesn't. And so this then is the occipital bone. Obviously, one of the important features in humans is upright stature, the fact that we walk upright. Many other apes, like chimps and gorillas, they have more of a quadrupedal stance where their spine is angled and they use, their knuckles to walk. And one can actually see that in apes and in, the early fossil apes and catarrhine primates, that foramen magnum enters the skull at an angle. But that changed in the fossils, which we call hominins, because if you were to look, say, at Australopithecines, like Australopithecus afarensis, and then all later ones as well, notice this foramen magnum is not here, as it would be, say, in a chimpanzee, a gorilla, or more primitive primates, but rather it's here. This means that then the spine is directly underneath the skull, and this means that this individual is now obligated to walk upright. They are an obligate biped, as opposed to being a quadruped, depending on their arms for locomotion, only occasionally going upright. And so even though this hole from here, moving the foramen magnum from here to here, would only be, an inch or two of a migration, nevertheless, this made the difference between quadrupedal locomotion and upright locomotion. So obviously, quite a significant change. The temporal bone is a very complex bone and takes a while for students to master all of the portions which they need to. So the temporal bone is there. We can see it from multiple views. One of the first things that we notice, any of these images will do, is that there is a hole. We have a hole in our skulls that we often don't think of, and it is this hole through which jaw muscles pass. So if we didn't have this hole, your jaw muscles attaching to your lower jaw could only be this long. We want them to be longer. We want them to stretch here, and so that way we have a more powerful bite. And so the jaw muscles will pass through this hole, this hole, known as the a temporal opening, and thus we are synapsids, if you will. We have this temporal opening. The lower jaw is clearly in this area because, as we'll mention again, here is then a depression, what's known as the mandibular fossa. It is here where we have the mandible touching the cranium, and our joint then is called the TMJ, the temporomandibular joint, because we have a joint between the mandible and the temporal bone. So the lower jaw will articulate there, and we have muscles which attach to the lower jaw, but they then pass through this opening. And you'll notice that this opening is then lined by two bones. There is the zygomatic process of the temporal bone, and then there is the zygomatic bone. So the zygomatic bone is a bone of the face, But here you can see the zygomatic process of the temporal bone helps to form part of this zygomatic arch. So when we look at the human skull, notice these are the holes through which your jaw muscles pass. They are surrounded by this bony arch, a zygomatic arch. You can feel it if you take your fingers and take it from your zygomatic bone to your ear, and you touch both your zygomatic bone and then the zygomatic process of the temporal bone, which helps to make this zygomatic arch. And here's the mandibular fossa for the lower jaw. The muscles which attach to the lower jaw can then pass through this hole and then anchor here. So thus we have longer jaw muscles, which have a, giving us a more powerful bite, all right? So once again, here you can see the zygomatic process of the temporal bone. Now in this region, the temporal bone, we see a number of additional points of interest. The opening for the outer ear. Obviously sound is coming in here and then reaching my middle ear and inner ear. And so this is then the opening, the external auditory meatus. Sound information then goes into the middle and inner ear regions here. We also have a styloid process. Doesn't have to be quite as long. This is a bit longer than usual, but we vary in our skulls. A number of bones have what's called a styloid process because the early anatomists were reminded of the stylus pens, like a feather quill that they could say dip into an inkwell and then write with. So this reminded them of a stylus. So that was a styloid process. Ligaments which hang the hyoid bone attached to this styloid process. And then there is a mastoid process. And this you might want to remember because there's a muscle called the sternocleidomastoid. It comes from the sternum and clavicle, hence the sterno and cleido. Cleido is Latin for clavicle. The sternocleidomastoid goes from the sternum and clavicle to the mastoid process. And this is the muscle which we use to shake our heads yes, or to to flex our necks as we do when we say yes, or if we're just using one, we can then rotate the head. So muscles which move the neck attached to this triangular mastoid process, which you can feel behind your ear. So when we look at this view of the temporal bone, you can see the external auditory meatus, the mandibular fossa, the mastoid process, the styloid process. Okay. Notice that the styloid process can vary. It isn't always quite as long. It's fragile, so in many skulls, it can be broken. Once again, external auditory meatus, styloid process, mastoid process. And then when we look at an inferior view of the skull, we can see openings or foramina. And so notice here you have the carotid foramen or the carotid canal. It is here that the internal carotid artery then passes through the skull to send oxygen to the brain. And then posterior to it, you have the jugular foramen, which is a bit larger for the internal jugular vein, but also some cranial nerves. And so if you were trying to find this in lab, maybe you would say find the Foramen Magnum and the Occipital Condyles on either side of it. And then here, the styloid process and the mandibular fossa here. And in the area between the styloid process and mandibular fossa here and the occipital condyles, you would see two openings, a narrow tube through a bony core of the temporal bone, that's the carotid foramen, or in plural foramina, and then the broader jugular foramina for the jugular vein and some cranial nerves. And so there are a couple of structures there of interest. Now the temporal bone is very complex, and actually it is made from different pieces which also fuse, like there's a petrosal portion and a squamous portion which fuse. And there's a space then which forms inside the temporal bone. The temporal bone has a space in the middle where the middle ear and inner ear are located. And there are actually little bones here, as I'll mention again at the end. So these three bones are actually bones of the skull: the malleus, the incus, and the stapes, what some people call the hammer, the anvil, and the stirrup. These help us hear. These are bones of the middle ear, and the middle ear is actually located inside the temporal bone. So notice here's the temporal bone region. Part of it has been removed, the squamous part. This is the petrosal portion. Notice here's the part of the mandile, the condyle, the mandible, the condyle of the mandible, which fits into that mandibular fossa of the temporal bone. So the TMJ is the joint between this and the mandibular fossa of the temporal bone. The next two bones are difficult to see unless you remove the face. So here in pink, you see the sphenoid bone. All right, and the next one will be the ethmoid bone, but notice that the face has been removed, and now you can better see them. Notice that the sphenoid makes up part of the orbit, but once again, without the face, you can see this better. Now, as it makes up part of the orbit, there are spaces in between where it meets other bones, and so we could refer to the superior orbital fissure, the inferior orbital fissure. And when we look at blood vessels and nerves, say in the nervous system, you may identify that, here are cranial nerves which pass through, say, the superior orbital fissure. So we can see the sphenoid bone from that view. If you were to look at the what's known as the internal base of the skull, so here's the internal base of the skull, the sphenoid is kind of in the center, all right? Some people compare it to a butterfly, and so as such, some people refer to greater wings. So here's the middle of the sphenoid bone, the greater wings of the butterfly or the sphenoid, lesser wings, what's known as the pterygoid process. These were separate bones which fused once again. So once again, a complex bone. There is a little pocket known as the sella turcica, or Turkish saddle. This is kind of right center in the internal base of the skull. And this is an important region because, one, this is where the pituitary gland sits. And so the pituitary gland is there, the hypothalamus is right over that. But then also the optic foramen, there are two of them, optic foramina going out to the eyes. So where the optic nerve brings in visual information, passes here as well. So here would then be the sphenoid bone, and in the center, the sella turcica and the optic foramina are important. So here, once again, is the sella turcica of the sphenoid bone, and this then is the optic foramen or optic foramina, which then go out to the eye. The sphenoid is one of the three bones of the cranium, which has a sinus, an opening to lighten skull bones, provide a resonance chamber for speech. So here you can see the sphenoidal sinus. There is the sella turcica there. So the sphenoid is an important bone of the skull. Once again, here is the sphenoid in the center. There's that sella turcica. Here's that sphenoidal sinus. There's the frontal sinus. And then the final bone of the cranium, the ethmoid, also has a sinus. So here you can see sphenoidal sinuses and then ethmoid sinuses as well. So the frontal, the ethmoid, and the sphenoid are the three bones of the cranium which have sinuses. The maxillary bone is the one bone of the face which has a sinus. Now, the ethmoid, here it is in yellow. Once again, easy to see if the face is removed, but when the face is present, obviously this is difficult. The sphenoid and the ethmoid, they help to join the face and the cranium. And so very often anatomy labs will have a skull which is then disarticulated, and so that you can then see here's the ethmoid bone clearly once it's separated from the other bones. You can also see the ethmoid from a few other views. Notice there is a septum, which then splits the nasal cavity into two. We have this nasal septum, and the nasal septum is composed of two bones. There's a vomer of the face, which I'll mention later, but then there is the superior portion is made up of the ethmoid bone, and particularly the perpendicular plate of the ethmoid bone. So the ethmoid bone composes part of the nasal septum. Also notice that the ethmoid has these conchi, these plates which stick out into the nasal cavity. When we inhale, we don't want necessarily this air to go straight to our lungs because it might be cold and dry. It might have dust or germs or diesel particles. So what happens is that we have these plates sticking out into the nasal cavity, which are called conchi, and the two of the three pairs of conchi, the superior and the middle conchi, are parts of the ethmoid bone. They cause the air to swirl around. Thus, if it's cold, it warms up. If it is dry, it humidifies. If there's germs in it, the germs get stuck in mucus. So these conchi are parts of the ethmoid bone. Also notice that there are little tiny holes here. It is here that the olfactory nerves travel from the olfactory bulb and then go into the nasal cavity. So if you were to look in the internal base of the skull, here's a really good place to see the ethmoid bone. This is the frontal bone, but there is a little part of the ethmoid bone, which is here. Notice all of the little holes for those olfactory nerves reaching the olfactory epithelium in the nasal cavity. This region of the ethmoid bone is called the Cribiform Plate, and there's this vertical ridge known as the crista galla, which reminded early anatomists of a rooster's comb, and so that's what its name literally means. And so once again, if you look in the internal base of the skull, this is a site where you can see the ethmoid bone. So those are the bones of the cranium with some structures that you might need to know.